Welcome to the third session of the Newton-Wellesley Hospital Healthcare Career Exploration Series. Thank you for taking time during this busy season to join us and learn about careers in healthcare. My name is Amy Ryles, and I'm a member of the Workforce Development Council and the Director of Human Resources at Newton-Wellesley Hospital. I have worked in human resources at Newton-Wellesley in various roles over the last 25 years. In my current position, I work with a team of human resources professionals to deliver services to support the mission of the hospital and our workforce community of over 3,700 employees. As a member of the Workforce Development Council, I've had the opportunity to work with hospital leaders and community partners on programs that expand potential career options in the community in hopes of enhancing financial security and building a strong pool of talented people to work in local businesses. The goal of this work is ultimately to improve the health and wellness of our communities. The Council has supported initiatives like the Waltham Summer Youth Intern program at Newton-Wellesley and education programs for students and adults focused around healthcare careers like the series we're offering this evening. There are so many reasons to choose a career in healthcare, many of which you will hear about tonight. Healthcare is one of the fastest growing occupations with a wide variety of choices, from those in patient care areas or clinical roles to administrative positions, leadership, technical, and support service positions, which really are the foundation to support the work that we do. You have the opportunity to learn and grow in a team environment that is fast-paced, dynamic, and most of all, regardless of the role, the ability to make a difference in the lives of our patients and communities through the work that we do every day. I'm so proud to work with such talented and inspirational individuals like the team that you will meet tonight. And with that, I will turn things over to my colleague, Beth Downey, who is the Chief Information Officer for Newton-Wellesley Hospital and the Chair of the Workforce Development Council, who will facilitate the rest of the program. Thank you again for joining us and enjoy the evening.
Thank you so much, Amy. Good evening, everyone. We're so excited that you've joined us for, as Amy said, the third of our 4 panel discussions. We will hear from healthcare professionals about their careers in various healthcare roles. We will discuss their career journeys, the educational requirements for their roles, and some of their day-to-day experiences. We'll provide an opportunity for you to ask questions of our panelists and understand their roles and career journey to determine if it might be something of interest for you. So as Amy said, my name is Beth Downey. I'm the Chief Information Officer at Newton-Wellesley Hospital, and I'm also the Chair of our Workforce Development Council, which is the host for tonight's event, and I will be the moderator this evening. So we want these sessions to be as interactive as possible, as much as a webinar can be, and provide you an opportunity to ask questions to the panelists. So please submit any questions that you have using the Q&A feature, and then I'll pose those questions to the panelists. And please feel free to start submitting your questions in right away. You don't need to wait until after I've had the conversation with them. So we also are recording the session tonight, and it will be posted on YouTube for future viewing. So if anyone is not able to attend. So tonight's panel discussion focuses on healthcare careers that require 2 years or less, of additional schooling after high school. So the panel includes a medical assistant, patient care assistant, respiratory therapist, phlebotomist, food services, environmental services, patient transport, and materials management. The panelists will introduce themselves and I'll ask them a series of questions, and then we'll open it up to review the questions from all of you. So I encourage you, like I said, to start submitting your questions as soon as they pop into your head. So now we're going to start our panel discussion. So I'd like to invite our panelists to turn on their cameras and unmute themselves. Excellent. So here we go. So here's the list of panelists that we have. Soraya Lizarazo is a medical assistant. Angela Vandenboom is a patient care assistant. Samantha Cafaro is a respiratory therapist. Lori Payne is phlebotomist. Paul Seeley is our director of support services, and he will be speaking to the roles in environmental services, materials management, and transport. And Emmy Rizik is going to be talking about food services. Emmy, I don't know if you can turn your camera on. See you.
No, I have it on. You can see.
No, you can't see you. It looks
myself.
like It looks like it's off. Maybe if you
Hmm.
toggle it back and forth and see if it goes on.
Oh, can you hear me there?
We
No?
can hear you, yes.
Okay. Let
So
me
I'm
see.
going to need to stop the share for right now so that we see all of our faces.
See if I can join from my cell phone then, my cell phone camera.
Well, it's fine. You can leave your camera off if you can't get it to turn on. The most important thing is that we can hear you.
Okay.
Okay, so let's get started. So I think what we'll do is I will go around and ask you each to introduce yourselves in a little more detail. So I will call on you. There we go, Emmy, we can see you now. And sort of ask you to introduce yourselves and what your role is at Newton-Wellesley in a little bit more detail. How long you've been at Newton-Wellesley, maybe where you're from. Whoop.
Sorry, hold on.
That's all right. You just need to mute your other.
Got it.
There we go. Okay.
Right.
So how long you've been at Newton-Wellesley, where you're from, and just a little bit about yourselves. So why don't we start with Samantha? You're up on the top of my video.
My name is Samantha. I'm a chief respiratory therapist at Newton-Wellesley. I've been here for 8 years. I've been in the leadership role for 3. My journey here has been, I started off as a new grad and now I've been here for 8 years. I work in the special care nursery, ICU, and the ER, and I'm responsible for 25 people in my department.
Excellent. Thank you very much. Sarai.
Hi, so I am a medical assistant. I've been with Newton-Wellesley for 13 years. First was a private practice, and now we are part of the hospital. And
Excellent. Lori.
I am a phlebotomist. I've been in a leadership role now for 2 years. I'm actually the outreach coordinator for phlebotomy. I have about 65 phlebotomists on my team that we send to various locations as well as the hospital every day.
Excellent. And how long have you been at Newton-Wellesley? Did you say already?
I've been at Newton-Wellesley for 5 years and in a leadership role for 2 years.
Excellent. Great. Thank you. Angela, how about you?
I am a patient care associate and I work on an orthopedic med-surg floor. I've been at Newton-Wellesley for 1.5 years.
Great. Thank you. Emmy, how about yourself?
I've been at Newton-Wellesley Hospital for 3 years now. I've been in the same role in food service as a retail manager since then. I have about 15 people under my supervision. I oversee the Starbucks named Charlie's, the cafeteria, help with room bookings, catering, and some in patient services.
Excellent. Thank you. And Paul.
Hey everybody, I'm Paul Seeley, Director of Support Services. I oversee, as Beth said, 4 different large areas. I have about 275 employees. I've been at Newton-Wellesley almost 5 years as a Director of Support Services, and prior to that, I was at North Shore Medical Center as Director of Support Services.
Excellent. All right, great. Thank you. So I think what we'll do next, because I know I've learned what some of your roles are through some of these panel discussions and just because I've been in healthcare for a long time. But I think what we should do is go through, we'll go around each person and sort of explain what your job is and what you do. So Samantha, why don't we start with you? Can you share a little bit of like, what is a respiratory therapist and what do you do to take care of patients?
So being a respiratory therapist, we play actually various different roles. We also, we work with any patient from newborn to the elderly. We take care of them from a breathing standpoint. So whether they need neb treatments, they might need to be placed on life support, or at the beginning of birth, we'll attend high-risk deliveries for moms that may have any type of complications, and there might be some compromised stuff that happens with the baby. So we actually will go there and assist in helping them take their first breaths. We do place them on life support and manage the life support through looking through different lab values to make sure that the current settings they're set on are appropriate for what they may need. We also help in asthma education as well as COPD, which are different types of disease processes for the respiratory lungs. We also work in transport, not physically here, like transporting patients. At this particular hospital, my old hospital, we actually go out on the ambulance and pick up babies from various hospitals. So you're a part of the transport team, so you have that luxury. And you also kind of play a vital role in helping save someone's life when you have to manage their airway.
Yeah, excellent. Thank you. Saray, can you explain a little bit about what a medical assistant is and what they do?
Sure. So the medical assistant is a multi-skilled professional that will help the providers get the patient ready to get their vitals, depending on the specialty, or is PCP or is a primary care provider. Could be doing a phlebotomy in the office, could be administer immunization or various medication. Also, we can help patients with questions or give them advice or relay a message from the provider to the patient. Depending on the specialty, again, I work with cardiology. We mostly do vitals that we call blood pressure, their weight, the height, and their heart rate, that is mostly done by doing an EKG.
Excellent. So you're in an office setting, correct?
Correct.
Of a physician office. Are there medical assistants in the more of the main hospital space?
Not that I'm aware of.
Okay,
I
so they're
think and the inpatient side are more like LPNs and healthcare professional, like aides.
okay. Excellent. Thank you. Lori, can you explain what a phlebotomist is?
So phlebotomy is drawing blood through venipuncture, which would be taking blood from your veins. So basically, we draw blood. We have different areas in the hospital that we do this. We have phlebotomists that draw on inpatient rounds. So that would be to the patients that are in the hospital bedside. We do have a main lab where phlebotomists work in the main lab. And we also have many phlebotomists in offsite facility, which would be in a doctor's office. So we have 10 offsites where after a patient can see their primary care or go for, certain other doctors like cardiologists and things like that, we'll have a phlebotomist right in that office so they can have their blood drawn, and then we can take care of the specimen after the blood is drawn.
Excellent. Thank you.
Sure.
And then Angela, can you explain and I think I have it down as a patient care assistant, but I think you called it a patient care associate?
Yeah, we use them interchangeably.
Okay.
What PCAs do is we assist the nurses with anything they need. So our job's really task-based. We do vital signs, blood sugars, EKGs, whatever the patient needs specifically, like help with ADLs, toileting, ambulating, and anything specific to that patient, like strict INOs. And it's a lot of communicating with the nurse, any task that they can delegate within our practice.
Excellent. So PCAs, I think, are primarily on the inpatient side of things, correct?
Right,
Okay,
yeah.
great. And I think what we've learned in some of our previous sessions is a lot of times folks who are in nursing school will start off as a PCA to get some of their clinical training and experience.
Yeah, about half of the staff on our floor are nursing students, and the other half went through a PCA program.
Excellent. Great. Emmy, would you like to talk about some of the roles in food services? And I don't know, Paul, if it would make sense to pull up that career ladder at this point.
That would be great, Beth. Thank you.
All right, let me get that up. I think that is sharing right now.
Yes, it is.
Yes.
Yep.
Okay, great. So excellent. So Emmy, would you like to share some of the food services roles?
Sure. Well, I've been in healthcare since 2007, and I started as a retail supervisor. Then I became a manager for retail. Then I became a retail operations manager at North Shore Medical Center and a director for food service. Then I joined North Shore Medical Center as a retail operations manager. And in this role, mainly I'm responsible for the menu in the cafeteria, the food that is served, the food safety that entails to make sure our food is safe when it's served to our customers, meaning the hospital staff and the visitors that go to the cafeteria. Making sure we have a diverse menu and plenty of variety to satisfy all our staff throughout the hospital.
And we're not easy to satisfy, are we, Emmy?
Well, we try to keep us. That's why the variety has to be extended and keep extending. But
Yeah.
it's great. It's one of the places where I feel that anyone that goes to at least can get a smile when they get their food in the hospital. Also, Charlie's, make sure we have the coffee to get people going early in the morning and in the evening, since we're open since 6 a.m. until 12 p.m. at Charlie's. So anyone in any shift can get their drinks and can have something to eat when the cafeteria closes. Also, making sure that anyone who has orientation and have different meetings throughout the hospital have a room and they have the tools needed, like a computer, a projector, microphones, and Zooms or Teams available so they can have their meetings, whether it's in house or it's a virtual meeting. Also catering, like today, make sure everybody got their cookies. Hopefully everybody did. I haven't received any emails since 4 o'clock. So that, and making sure the patients are being fed as part of the kitchen management too. Making sure that the patients get their breakfast, lunch, and dinner on time, and make sure that it's according to their diets, and making sure we have enough staff to deliver the services that we provide.
Excellent. So do we want to talk about, and I don't know if Emmy wants to do it or Paul does, the various roles in food services that someone might be able to fill above and beyond what Emmy just described? So like what's on this grid here?
Starting from the bottom, I think if we have food service workers, which would serve food, prepare the trays, assemble trays to go up to the floors, deliver food up to the floor, which are called ambassadors. There's other food service workers in the call center who take the orders that go to the line where the cooks prep the food and then gets assembled to go up to the floor. So we're talking about food service workers, 1, 2, and 3, which are the ones in the dish rooms. I consider food service worker 1. The ones in the tray line could be a 2 or 3. And then we have the cooks. We have cooks, sous chefs, and the chef, which is a higher position in terms of not only pay, but a grade. And then we have the supervisors who are in between the food service worker and the managers, and they would do every position that's available in the kitchen when we don't have enough staff, but also make sure that the food is safe, and manage the staff, do scheduling, and get ready to become a manager.
Right.
By taking all the trainings necessary and getting somebody else ready under their belt so they can take over their positions.
Excellent. Thank you. And then one of the next things that we'll do is go through and talk about the training requirements or educational requirements for all of those roles. But I'll first turn to Paul and say, so for the 3 areas that you are here to represent, would you like to share some information about those different roles and kind of what they do?
Sure. Yep. So in support services, our staff usually follow 3 different career tracks. One career track might be start off in one of these entry-level positions under stage 1, and then plan a career with Newton-Wellesley, eventually get promoted to stage 2 and then potentially stage 3 as a supervisor or above. So that's the first career track. The second one might be an exploratory kind of thing, where you would work in one of these areas like food service or transport, get some experience, and then decide what you want to do. Like I have a niece of mine. She wanted to be a nurse, and so she worked in the kitchen at another hospital. And because of that experience, she decided she wanted to go a different direction because she really didn't think she would like nursing. And so it's a good opportunity to kind of explore what it's like to work in a hospital and see different things in a hospital and kind of see where you fit. And then we also have other folks who take a gap year after high school, and they really kind of need to figure it out. So they'll come and they'll work full time and then get a feel for what they want to do later on. So we have kind of 3 different areas. But for environmental services, you would start off either as a housekeeper or project worker. And then the housekeepers would either be doing daily cleans in the patient's rooms or discharge cleaning for patients who have left. Project workers do like a lot of the floor care that we do and cleaning the public areas. In materials management, we have distribution techs 1 and 2. They'll go up to the units and they'll do an inventory of what's in all the medical supply areas, and they'll actually order all the products for their area. And then the products would come in the next day and they would put it all away for their medical supply rooms. That's distribution tech 1. And then we also have the OR distribution techs as well. It's kind of doing the same thing. In transport, they transport the patients all around the hospital. They get a page as somebody puts a request in the system, and they'll get a page, and they will transport the patient from place A to place B, or they also might move medical equipment around. And as Emmy said, in food service, they'll start off either in the cafeteria or the kitchen, one of the retail areas that we have, and then the more experience you got, you'll get promoted up to different positions. So there is a career track in each one of these areas, starting off at stage 1. Stage 2 would be if you want to stick with us and get a promotion, you would move up to a group leader type position and then potentially supervisor.
Excellent. Great. So I'll take this down for now, just so that everyone's video gets large for everyone who's attending. So what I want to do now is to sort of talk about the any education or training or certifications that are required for each of your roles, because they're each of the roles that we've talked about. So Samantha, why don't we go back? We'll start with you again. Can you just share with us what training and education and certification is required to become a respiratory therapist?
So it's a 2-year associate's degree to become a respiratory therapist. What you have to do is you'll go through and it's more of an applied science. So you go through your anatomies and physiologies and everything. And you do have to complete a certain amount of clinical hours. Mine had been, when I was in college, 325. So 325 clinical hours. So that will be for your first year in college. It'll be learning how to become a therapist. So learning how to do vital signs and identify breath sounds and making sure that you can understand when there could be potentially a problem with the patient. You'll attend, sadly, code blues or any type of critical things that you will need to have that developmental skill. Then in your year 2 is when you actually physically get to go to the ICUs and to the NICU. And you'll start seeing pediatric patients, the younger population, learning how to identify their type of vital signs. And also when they're in distress, because, typically babies can't talk yet. So you have to physically look at them and learn how to get their general appearance to know how to identify distress. And then when you work in an adult ICU, you'll learn how to manage the ventilators at that point as a student. And then from there on, you'll graduate and you'll take a registry exam or a certification exam. So it's a 2-part test. It's a clinical sim as well as a certification/registry. So the higher you get on that exam you'll just automatically accede to a registry instead of becoming a certified therapist. So I'm currently a registered therapist, but you can become a certified, but we're trying to move into the, bachelor's/registry category going into the next couple of years for respiratory therapists.
Okay, so it will change from just 2 years to needing a 4-year degree.
Yes, pretty much. It's moving in that direction. So the AARC, which is the respiratory, it's American Respiratory Care Society. So they actually are starting to move this into, they're trying to change it and make it more like on a nursing level. So they want you to have, your registry as well as a bachelor's degree. It's been on a 5-year plan for a while. So we're coming up on 2 years left.
Okay.
for that.
So the school that you go to, did they help you? Are they sort of affiliated with a hospital or something to get you connected to do those clinical hours? How did you get to?
They are.
Yeah, they are. Okay.
So the school typically has offsites that they are connected with. So I'm actually from Rhode Island. So I actually went to New England Tech, which is a technical institute college. So it's a 18 months straight through. And what I did was, they were affiliated with like hospitals in Rhode Island, which would have been equivalent to Mass General out here. It's called Rhode Island Hospital. I worked at Women and Infants as a, interim and all that stuff, but they get all these clinical sites so that they can send everybody out. Out here, I believe it's Massasoit College, Community College that offers that. So they will connect with the local hospitals like BMC, MGH, Brigham and Women's, and they get a certain amount of hours where they have to have like an accreditation, and they also have to have some type of education with the hospital for them to be able to let their students come in. So they will be assigned a preceptor and they'll be able to go out.
Okay. So it's probably really important to make sure whatever school you're looking at has that clinical affiliation. Because I would imagine it would be hard if you went to a school that didn't and you were required to sort of find that on your own. It's probably hard to get in somewhere.
It is. Not many places around here offer, like, you can't become a respiratory therapist unless you have some type of clinical experience. So a majority of the colleges that are around the area do offer that. So which is lucky. So you don't have to do that.
Yeah. So you got to make sure that that's something for anyone who's interested in it, that they should make sure that they're picking a school that has that all in place.
Yes. And if you're a hands-on learner, you would really want to use up this clinical time that you can and ask as many questions, do as many hands-on things for you to understand, because in respiratory, you have to know a lot and you only have a little time to do it.
Yeah, definitely. All right, great. Thank you. Saray, would you like to talk about the training that's required to become a medical assistant?
Sure. So the training, depending on the institute or the facility the person applied to, could be between 6 months to a year. The 6 months, they will give you the basics. They will show you how to do the blood drawing, the EKGs, get comfortable checking the blood pressure. And the year will give you more intense training on how to assist on minor procedures that could be vascular procedures, and then go more into depth into the whole body, how the body works, and what you could do to assist the doctors to get them ready for the appointments. And definitely you need to as well do an internship, and most of the institutions arrange those for the students.
Okay, excellent. Thank you. Lori, what's the training for phlebotomist?
So phlebotomists just require a certificate, very similar to medical assistant. There are many courses out there. You can find 12-week courses, 16-week courses. There's actually a 10-week course that's Monday through Friday, 8 hours a day. So depending on what your time constraints are, you can find a lot of different courses. They have courses around here. Mass Bay is a great place. Massasoit has classes. There's also smaller places. There's a small certificate course in Worcester called Fieldstone. There's a 911 programs in Rhode Island. And basically, just like you were saying with respiratory therapy, you just want to make sure through that course that they're going to set you up for your internship. So once they set you up for your internship, then you can get your clinical hours. And every course that I've checked out will place you. So again, it makes it a lot easier for you. a lot of places where you intern, they're also interested in maybe keeping you on. So I like to tell people, you know, your clinical time, especially in phlebotomy, is very important. It's very important to, you know, try to learn, just like respiratory therapy, try to learn absolutely as much as you can in those clinical hours, because it's very helpful to, you know, pursue your career further.
Excellent.
Also, in phlebotomy, we have a national exam. It's not required everywhere. Certain states require that. Massachusetts does not require it. But that's something that you want to look into depending on where you're going to live, if that is a requirement.
Excellent. And I think most, if not all of the jobs that we're featuring tonight, these are all jobs that are in need in healthcare and usually have a ton of open positions, so that if somebody is really interested in getting into healthcare, maybe they want to move further into a career that requires more schooling later, but they want to get their foot in the door and get started in an organization. These are the types of roles that you can get started with, and you most likely can get a job very easily, because we usually have a lot of postings for these. And it's not just at Newton-Wellesley, and it's not just at Mass General Brigham, it's healthcare across the nation, that these are roles that are usually pretty hard to fill. So if somebody is looking for to get started in healthcare, these are some great roles to get started with and figure out, like Paul had said, you know, sometimes you think you might want something and then you start it and you're like, maybe that's not what I want. So if you're not really sure, it's a great way to start. And really, I think there's no such thing as bad education. You're learning something that you can then build upon if you decide to sort of change your path a little bit. So excellent. Angela, why don't you share the training that's required for PCA?
Yeah, the education for the PCA position, you can take two routes. So I'm a nursing student, and after the completion of your first fundamentals clinical, that whole clinical like shapes you into the patient care role and teaches you how to do the job that way. And the other route is a 6 to 8 week course that teaches you vital signs and daily cares of the patients. And then during the orientation, they check you off on all your competencies to make sure that whichever path you chose, we all are on the same page.
And that you know what you're doing.
Exactly, yeah.
Excellent. So in fairly short order, you can be fully trained and start working as a PCA.
Yeah.
That's great. Are there any do they test your competencies regularly, like annually, anything like that?
I know at the end of a CNA PCA course, you have a like a state test. So there's a written component and a clinical component. And just during the orientation part at Newton-Wellesley, we were checked off on 5 or 6 competencies before we're allowed to go to the floor.
Okay, great. All right, excellent. Okay, so I'll throw it out to either Paul or Emmy. I don't know how you want to do the overview of the educational requirements of all the roles that we talked about in your areas.
Okay, I can talk about food service workers.
Great.
So usually food service workers, if they're starting the dish room and they want to continue to grow within our department, they would learn how to put the trays together, which is the food service worker one. They will learn the different diets that we deal with in the kitchen and the patients may be put on. And then if they really want to continue in food service, they would train in the cafeteria, serving food, learning the food safety codes. They can be ServSafe certified if they want to continue and become a cook or become a lead as a cook or a grill cook, to make sure that our food is safe and maintained at the right temperatures, whether it's cold or hot, before being served. They will also be, when they get ServSafe certified, it's every year, they need to be certified, they need to renew their certification. And it teaches them about sanitation, food safety, physical safety, and cleanliness. After they become a lead, they can be trained to be a supervisor and learn about all the reporting and numbers, food cost, how to create the prices in retail, and have a better understanding of how to maintain a safe inventory, how to get the food in, how to prep the food, how to serve it, and make sure that we have the products that we need to produce the menu that we create for our either patients or for our staff in the cafeteria. And then in my position, an associate's degree is required. I have a associate's degree in management and accounting. I also got one in general science. It was all within the same. I went to Roxbury Community College for 3 years. I did 1 year of ESL, English as a second language, and then I got the associates. Then I went to UMass Boston for my bachelor's in management, but I've still got 6 or 7 courses left that I never finished due to financial issues. I was already working full time, and I couldn't quit my job. And also be CERT certified. Like I said, all managers are required to have at least 2 years of experience in management, in food service, and have a good track record with staff.
Great. So the food service workers, and when folks start in your team, is it a high school diploma that's required? And then
Yes.
You're training them on all of the specific procedures. The what did you call it? The safe.
It's
training?
a CERT safe.
Is that training that you provide at the hospital, or do they go somewhere else for that training?
So we can provide it at the hospital. It's a state certification, but we do provide it. We have proctors that go to the hospital. They can go to the hospital, or we can set up a class. As a matter of fact, Paul just set one up for February. We have a lot of cooks that have not been CERT certified, or their CERT certification is about to expire, and we want to make sure we renew it before that happens.
Okay, so is that training that's covered by the hospital? The employee's not paying for that training?
Correct.
Excellent. Well, that's great. Okay, I think that's all my questions for now, but I'll be back. All right, Paul, I'll turn to you. Can you go through and give us an overview of educational requirements for your various other departments?
Sure. So the entry level positions don't require a college degree. They're just high school diplomas for most of them. And for the most part, we don't hire a lot of high school students. Usually we hire people past high school with their degree. For the leads, well, it's on the job training as well. We'll train you in leadership. For the supervisors, I do have some supervisors that have years of experience. And I also have some that have associate's degrees or bachelor's degrees. So it's a kind of a combination of each. All my managers have bachelor's degrees.
Okay. But there's opportunities for the staff who started with a high school diploma to work their way up.
Up to supervisor, sure. Absolutely.
Great.
And then I do want to mention about the dietitians. I didn't have that listed on my chart.
Oh, yeah, that's good.
So that is a 4-year degree. We hire a lot of people, a lot of ambassadors actually from Framingham State who offer that nutrition degree. If you do want to become a dietitian, you really need to get your feet wet in the hospital in the food service department, because a lot of people don't realize is that after you finish your nutrition degree, you have to do an internship for 6 months. And it's very competitive to get one of those positions. Only about half the people who have a nutrition degree enter the dietetic internship program, just because there's not that many offered. So if you're thinking about becoming a dietitian, you really should definitely think about spending some time in our nutrition department.
Excellent. All right, great. Okay, so I think we've covered the educational requirements. So why don't we, and we've given an overview of sort of what the job is, but why don't we get into sort of the day-to-day of what your day is like, and maybe sort of what the various shifts are, because I think that sometimes can be maybe a little intimidating for someone when they think about working in a hospital, that maybe I don't want to work on every holiday and I don't want to work an overnight shift. Not all jobs have that. So I think, Samantha, why don't we start with you? If you can sort of talk about what is a day like for a respiratory therapist, and what are the various shifts that you might need to work? Because I'm guessing in an inpatient space, you guys are manning 24/7, 365, I would assume.
We do. Our shifts are typically either 7A to 7P or 7P to 7A. Occasionally we have those 7A to 3P or 3 to 11 shifts, but we're kind of going to 12s mainly. We come in, so typically if it was a day shift, we would come in and get report in the morning on various areas. So here we staff 3 therapists on in the morning. So it's usually someone that's going to cover the special care nursery, which is like a NICU, a small one. Then somebody who's going to take care of the ER for the day and some of the med surg floors, and then someone who will mainly take care of the ICU. The therapist will come in, they'll get report on each patient, learn about their settings that they might be on, if they needed some CPAP for a patient that might have some obstructive sleep apnea and they are on overnight and they're coming off in the morning. They'll give out breathing treatments at scheduled times depending on if they need them or not. The ICU, they start as soon as they pretty much come in around 7 a.m. and they will go down there, they'll take a look, they'll pass off report to each other, learn about each patient, depending on if someone's on a ventilator, which if you want to know, it could be like a life support of some sort, or BiPAP, which is a non-invasive approach. So it will just be a mask that's on their face and applying some pressure to them. Or somebody that's just on oxygen in general. So they'll go down and they'll do a whole round with the therapist, learn about each patient, and then that therapist leaves the night one, and then the day one takes over. And then if you have the ICU, you'll round around 8:30 with the doctors and learn about the patient and if they're going to be weaning or some type of change in their settings. And then if you're taking care of the ER, unfortunately, anything can happen. So, you have occasional code blues. Typically anybody that comes to the ER, it's an emergent situation. In some cases for a respiratory patient, whether it be some type of BiPAP machine that they may need, ventilator support of some sort, or just coming down to evaluate a pediatric patient who's in some form of respiratory distress. That's the scope of assignment.
So do you get your assignments through, I'm assuming, through orders that are entered by the physicians into the electronic medical record? So so that's how you know who needs what treatment, I'm assuming, correct?
Yeah, so we use the Epic system and they'll come in and they'll be on a sheet. Each floor, like every med surg floor, has their own patients listed, and they'll have the order as well as the ICU.
Okay, great. All right, anything else? Oh, so you guys are here 24/7, 365. So holidays,
Weekend,
yep,
with
rain or
all the
shine,
time. That's
you're
true.
there. And I'm imagining with COVID, it has been even busier for you.
It really
and your
has.
team.
It really has. It's been a long 2 years, still going.
Yeah, excellent. All right, thank you.
you.
Saray, can you sort of get a little bit more into the detail of what your day is like, and for you in a physician office, sort of what the schedule is like?
So for the physician office right now, we're like Monday to Friday, 8 to 4 or 8 to 5. We try to schedule patients either every 30 minutes or 20 or 40, depending on the type of appointment they have. The day begins with just try to sort it out how many providers we have in clinic, and make sure they have all the necessary equipment in the room to see the patient, make sure all the computers are working. We bring the patient. The most important thing is to have the patient ready for the doctor. That means to do the vitals, do an electrocardiogram if necessary, make sure all the medications that we have in the system are the ones that the same as the patient is taken. And that takes about 10 to 15 minutes. And then we enter all the information into the Epic system, so the doctors have everything on hand when they log in through Epic just to treat the patient. And in between patients, if we have time, we try to do some administrative work, that is queue up the prescriptions for the providers, make sure what the pharmacy is asking, the medication asking to be refilled is the same information that we have in the patient chart, so we don't mix up any medication. And we queue up that for the providers. We call patients with if they have any normal test results, the medical assistant is allowed to call the patient as long as the results are normal. And make sure, like right now with COVID, make sure we follow all the protocols, make sure patients that don't have any symptoms before to come to the office. And we are in the virtual world right now, so we make sure to go over the medications as well through the phone with the patient to have all the information ready for the providers.
Great. Excellent. And so since you're in the office setting, as you were saying, you're pretty much open Monday through Friday. So you're not open on major holidays. You don't have overnight shifts or anything like that that you need to cover as a medical assistant, correct?
Correct. And once in a month, it depending on the load of new patients that need to be seen, a provider might be willing to come on a Saturday. So it's like once in a blue moon that providers work on Saturdays or holidays.
Right. So that's an opportunity for a little overtime, probably.
Right.
Right, which is always good. Excellent. So what I want to try to highlight in the varying roles is depending on someone's home situation and their responsibilities, sometimes the idea of a job that might be overnight or on holidays isn't as appealing to them. So that's why I wanted to sort of make sure that we're being clear that a medical assistant could be a great entry point for someone who's not looking to work on major holidays or things like that. So thank you very much.
Correct.
All right, Lori, can you explain a little bit about the day in the life of a phlebotomist and your schedules?
We have everything. We have everything.
Because it's in so many different areas, like you were describing, the inpatient space and the outpatient space.
So our inpatient rounds start at 5 a.m. Most of our shifts are full-time, so they're 8-hour shifts. So our 5 a.m.ers, usually we have about 5 or 6 that come in to do morning rounds. They'll work 5 to 1:30. We have our main lab opens at 6, so that starts going. We have 8-hour shifts starting at 6. Some people come in at 7:30, some work 8 to 5. Most of our outreach locations are the same as Saray would work 8 to 5 in a doctor's office or 8 to 4. And they most likely would not work holidays or weekends. The people over at the hospital, the people that do the morning rounds and that work in the main lab at the hospital, we have it set up that they do rotating weekends. So everybody kind of owns a weekend, and our rotation is every 3 weeks. So the holidays, we don't need as much staff. And because we have a pretty enormous staff, we're able to, we yearly assign holidays. So you have your assigned holiday, and we try to keep it very fair. And you can also switch shifts as long as you get it approved. So kind of anything's possible.
Oh, that's good to hear.
We also have per diem shifts. So if you're somebody who is interested in phlebotomies, taking the course, wants to come on board, maybe you're going to medical school, maybe you're going to PA school, maybe you're going to going to be an RN, you could work for us per diem, so you can be involved clinically and get paid while you're going for another degree. And that's probably about half our department does that.
Right. Excellent. All right. And then depending on where they're working, they'll be assigned, like you were saying, if they're in the inpatient space and they're doing their rounding, they're getting a list of all the patients that need blood drawn and what room they're in. And then they go with their basket of supplies.
Yep.
And so for anybody who's been an inpatient, you've seen that person. And I'm sure you get a lot of groans and looks like, oh, I'm not going to like this. Nobody likes you.
Nobody likes us.
No.
5:15 in the morning, that first patient knock on the door.
Poke you with a needle.
Yeah, I'm waking you up and I'm causing you pain. And it's all about how you present it, because some of them end up being your best friend after you finish.
Right.
And you're only there for 5 minutes, so it's not.
Yes. And some phlebotomists are just amazing. You almost don't even feel it. It's amazing. I'm always glad when it's over.
Yeah.
And thank them so much that they didn't cause a little tear. So, all right, great. So you guys are there all the time, you said.
Yeah.
But it's a lot of variety in the shifts, so that
exactly
you kind of can sort of pick a time that works best for you. So awesome. Great. Thank you.
Sure.
Angela, can you get into a little more detail of a day in the life and the schedule, which I'm guessing you're in that 24/7, 365 area?
Yep, we're there 24 hours a day. So we mostly do 3 shifts. We have some people that do like a 7 to 7, 7A to 7P, or 7P to 7A. But most of our staff is either 7 to 3, 3 to 11, or 11 to 7. So I work the 3 to 11 shift. And when I come in, I check in with my charge nurse to see where I'm going to be for the day, because as PCAs, we can also sit in a one-to-one observation. We have sitters who are specifically, their job is just to sit, so they don't take vital signs or do sugars or do a lot of ADLs, but they can sit and observe the patient. And we have the virtual monitors. So the virtual monitors, that's another PCA role. You can sit in a room that has, I think, 16 cameras between 2 PCAs, and you're monitoring from a distance patients to make sure that they stay safe. And there's alarms that go off that we respond to on the floors. So once I find out whether I'm on the floor or if I'm sitting, I check in with the PCA that I'm getting report from, and I'll check in the main points of my patients, because I'll have some days 8 to 16 patients, which is a significant amount of patients. So I'll find out how they ambulate, any safety needs, and anything specific to those patients. And when I come in at 3, I start right away on my 4 o'clock vital signs. And any patients that have blood sugars, that'll be around 4:30. And before going in those rooms, I'll check in with my nurses just to touch base and be like, hey, I'm going in here. Is there anything you need? Whether it's the nurse just like, oh yeah, when you go in, I want to just take a peek at that patient's skin, or this patient's having chest pain, can you get an EKG? And then I learn how to prioritize my day through communication, and we use the Volt messaging. So I work on a big unit with 35 beds, and you don't always know where your nurses are. So that is a savior to be able to text them right there and see what you need right away. And we work really closely with transport and food services, whether it's setting up a tray for patients or helping transport move an admission into the bed. Yeah, and we answer call lights. So
that was what I was going to say. When somebody so if anybody's been in a bed in a hospital overnight, when you press that call light, it's most likely a PCA that's coming to visit you to help you.
Yeah, and we have a new system. So the call lights will be different colors, whether it's pain, toilet, or water. So that's kind of nice. So you can look right outside their room and see above. If it's like a purple light, you know that they're going to need water. Or if it's a green light, I know that I can't answer it because the nurse needs to. So I can reach out to that nurse and let them know
That's
that
great.
way.
So you can come with the water, so you don't have to make an extra trip.
Yeah,
And
especially if it's a COVID room.
Yeah, right. Because you have to put on extra gear and everything before you can go in there, correct?
Exactly, yeah.
Yeah. Can you explain a little bit more on the sitter? Because we didn't talk about the sitters specifically, but can you sort of explain to folks why we use sitters? What types of patients might have a sitter?
Yeah, there's a couple of reasons why a patient would need a sitter, whether they're a little altered mental status, like they're not at their baseline, or that is their baseline where they're trying to get out of bed, but safely they can't get out by themselves, and they don't understand how to stay in the bed through redirection. So we'll have someone in the room for that, or an SI. So if someone's on any suicide precautions, someone will be in the room with them at all times. So any patients that we have come from McLean or a psych facility are immediately put on an SI until psychology can come around and a psychiatrist can evaluate them. And we also, in the pediatric unit, have eating disorders.
Okay.
So we'll sit with children going through.
So when you
eating
say
disorders.
sitter, you're actually sitting in the room with the patient, observing them the entire time, correct?
Exactly.
Okay.
At an arm's length away for the full 8 hours.
Yes. And then as Angela was describing, we do have a virtual observer sitter program where we put a camera in the room, and like she was saying, then she might be in this room where she's watching the cameras, and you can talk to the patients through the cameras, correct?
Yep.
Because I know my team supports the cameras, so
yep,
I know a little bit about the cameras.
Those are usually a nursing judgment for patients who are a little more redirectable, because to hear that over the camera, like, hey, don't get out of bed, and then they can redirect that way. So it's whether you need a person in the room or the camera is a nursing judgment.
Excellent. Okay, and so holidays and everything, you guys are scheduled. Very important that you're there all the time. So
yep.
Something to consider if you're looking at becoming a PCA. Excellent. So Emmy, why don't we talk about, you've mentioned a few different sort of tasks and jobs that the food service workers can do. So why don't we start with that? I know you've talked about some of them. If you could sort of describe what their different day would look like for their different things they can do.
So in food service, we also are open 365 days a year. We feed patients. We open at 5. We start at 5 a.m. in the kitchen. The cafeteria starts at 6. And Charlie starts at 6 too. So the schedule is pretty much the same. It's from 5 a.m. to 8 p.m. Monday through Sunday.
So you're not here overnight, but you're here every day.
Yes. Okay. So we'll make sure we have breakfast, lunch, and dinner for our patients and for our staff, whoever is working the day shift, the night shift, or the overnight shift. Yeah, so we have people that start in the dish room who come in and take care of the dirty trays and dirty plates from the overnight. We have the staff that start setting up the trays and the cooks who start cooking breakfast early in the morning to make sure our patients get their breakfast on time between 7 and 8:30 in the morning. Then we make sure we temp the food as they're cooking it and making sure it's safe to do lunch next. So we have the cooks again. So we have 3 areas in the kitchen. We have the cooks, we have the people that assemble and the prep, and then we have the transporters and the cleaners who work in the dish room. And another area is the call center.
Oh, we lost your audio, Emmy. Can't hear you. No.
Emmy, no.
Let's see. Technical difficulties.
No. He's muted.
There he goes. He's off mute. Can you hear us, Emmy? I don't know that he can hear us. Earbuds are going back in. Let's see.
Yeah.
Can you hear us?
Okay, I can hear you.
There we go.
Yes.
Okay. So I don't know if you remember where you left off.
I think I said we'll prep the lunch.
Oh, I think you were talking about the room service folks.
Yeah,
right?
the call center and
Call
ambassadors.
center. Yes.
Yes. So call center, they take the order first. That's the main thing, obviously, because without the orders, we can't prep the food. So we make sure we take the orders first in the call center. It goes to the line cook. So the cooks get the orders, whether it's cold food or hot food, then goes to the tray passers who put the trays together, and then the ambassadors who bring them up to the patients. That happens 3 times during the day: breakfast, lunch, and dinner. And we as manager, obviously, we come in the morning, we make sure we have the staff that's needed and the schedule to make sure we can deliver the food on time, and making sure that we taste the food. We have huddles, we have meetings with the staff throughout the day, every day, to make sure they understand and know any updates throughout the hospital, and any training that needs to be done, uniform, food safety, and any changes in the department, and making sure that we keep hiring to make sure we have enough staff in the department. That's another part that maintains us busy, especially now more than ever. And then at the end of the night, making sure that the area is clean, making sure everyone has food throughout the hospital. And if there's people that need food overnight, that they have some box lunches for the overnight patients, and making sure we clean and everything is safe before it gets put away at the end of the night and before they go home.
Right. And I think there's also refrigerators up on the patient floors that you guys probably keep stock in, correct? So that when I'm an inpatient and I would like some ginger ale, somebody can go and get me ginger ale, correct? So it's probably Angela that's going to go and get me a ginger ale, right?
It could be. The ambassadors too, who deliver food to the floors, they are in charge of whatever floors they do. They deliver food to. They also clean and check the food, make sure there's not expired food, make sure it's stocked with what's needed.
With everything.
They have a sheet, yes, and that's done daily.
Okay, good. And that's where there's all of that standard stuff. So anybody who's been an inpatient and knows that they can quickly get some snacks and drinks it's your team that's making sure that all of that is there in the inpatient space, right?
Yes, we have one position that it's called a stock person, who goes throughout the entire hospital, and wherever the ambassadors don't have time to stock, and the outpatient floors and spaces also have refrigerators, and they make sure that every area that has a refrigerator, it needs to be stocked. It has what is needed in every area.
Yeah, excellent. Yeah, there's so many. I mean, every role that we're talking about is just so important to every little bit of this whole hospital, making sure that we can take care of our patients in every way possible. Takes a lot of people to do that and watch a lot of these things.
It does.
So,
we have about 70 to 80 people in the
wow,
kitchen.
That's great. All right, so I'll turn to Paul because I want to keep an eye on the time, and we do have some questions that have come in from our attendees, so I want to make sure we have time to get to those. So Paul, if you could go through the 3 other areas and just sort of talk about what the day in the life and the schedule is for each of those areas.
Sure. One of the beauty of support services is you kind of have the opportunity, depending what position you're in, to work with patients or not with patients. Some people really like that patient interaction, like the ambassadors in food service, for example, really like to work with the patients. So the ambassadors are working in the same floors all the time. Same thing with housekeeping. The first shift in housekeeping, they work at the same unit, the same floor, and they get to know their patients. They're in the patient's room every day for about 15, 20 minutes, just mopping the floor, changing the trash, talking to the patients, doing a wipe down from room to room to room. They might do a couple discharge cleanings where as a patient is discharged, they would strip to bed and remake the room. And that's a 24/7 department, 365. So we have all 3 shifts covered. The second shift on environmental services does a lot of discharge cleaning because that seems to be the time when all the patients are discharged, usually after 2 o'clock. So they're changing the rooms over, less patient interaction, just to get the rooms ready for the patients in the emergency department who are coming up, who need a room. Patient transport, that's another department that has a lot of patient interaction. You're talking to the patients as you're bringing them from place to place. They might want to go down for an x-ray, or they might go for another test, CAT scan or something like that. So they're bringing the patients back and forth to different parts of the hospital. That role also might be delivering equipment to different areas of the hospital, and all the equipment requests get put in through our EPIC system, as well as the patient transports. And that department also does laundry distribution. So that's where you wouldn't have any patient interaction, but you'd be going in and stocking up all the units with laundry from the central supply we have in the basement. Materials management doesn't really have any patient interaction. So they're, like I said before, they're the ones going up to all the units, and they have their assigned units. So it makes it easier because then they know what they're using every day. And so they can kind of tell, like, if in labor and deliveries, their births are up, then they need to increase their supply, for example. So they'll go in and place all of their orders, check their PARs. It's all done on a handheld computer, do the bar scans, and then place all your orders through that department. Did I miss anything?
No, I don't think so. So,
Okay.
yeah, so environmental services,
24/7.
24/7, patient transport 24/7.
Yes.
Did you say environmental services isn't really having too much contact directly with the patients? It's mainly patient transport, or is environmental services?
Oh, environmental services does. Some of the roles in environmental services
Oh,
don't.
yeah.
Some
But
do and
some
don't.
would, because they're going into a room of where that has a patient in it.
Correct.
To do something.
Yeah.
Yeah. And then I think for a lot of these roles, you're not really sitting at a desk ever all day like some of us do. You are getting your steps in, and you're walking the entire hospital all the time. So those are some other things to think about, is if you're looking for a role that you're not just going to be sitting at a desk all day. These are great jobs to start with. And just like I said, with the food service worker and everything else, like really critical to the daily operations. And I think prior to COVID, oftentimes these folks maybe didn't get the credit how important they are. But that's one of the things that I feel like with COVID that is brought to light is how important every role in a hospital is.
Right.
So,
Exactly.
so I definitely think the support services group fall into that. Okay, let's see. So I think we've covered what the jobs are and what the levels of experience are. So I think I'm going to jump to our questions here because we have about 20 minutes left. So one that did come in, and I think we've covered this, is someone had asked, what would I be doing as a medical assistant day to day? So Saray, I don't know if there's anything else that you want to add to that you didn't say before.
Not really. The day-to-day is depending mostly on how many patients we're going to be seeing during that day and how many providers, including when I mention providers, that include nurse practitioners, and we work with a pharmacist as well, that she gets some education to the patient and help with the medication, plus the supplements that patients sometimes take.
Okay.
But the medical assistant role is mostly, like I said at the beginning, is a multi-skill profession, because you do some clinical and you also do some administrative work. So basically is the combination of both, because you get to room the patient, get the vitals, and then in between patients, you can do some administrative stuff, just call patients, and also, I didn't mention this before, is have all the information necessary, like medical records from other facilities that are not Mass General Brigham, ready for the provider for the visit, so they can get all the information and treat the patient properly.
Excellent. And Saray, there's actually another question for you. It says, how did you get to help with cardio as a medical assistant? I'm not sure if that means cardiology, because you're in a cardiology practice, correct?
Correct. So the medical assistant role in the specialty that I work with in cardiology is helping the patient with the medication. Sometimes we just need to make sure the patient taking the proper medication and the proper dosages. The medical assistant can help with the patient, also giving some guidelines. What with experience, you will know which medication will be affect if you eat certain food, or if you're taking a blood thinner, you can advise the patient not to, for example, drink, or try to make sure they don't do any activity that can cause any major cut or any major bleeding. So that's how the medical assistant help on that as well.
Excellent. Thank you. So this question, I think I'm going to go around and ask to everyone. So it says, are there any part-time positions for someone in a late career stage? So Samantha, do you guys have any part-time respiratory therapist positions?
We do have like a 24-hour position for any age group, to be honest with you. We do have, it is going to be either days or nights depending, but we do have part-time positions.
Okay, so they'd still have to have the same education. So maybe someone in their late career may not want to do it's associates now, but it might have to be the bachelor's and all of the additional training, but you do have some part-time roles.
We do.
Excellent. And then Saray, are there part-time medical assistants?
Yes, depending on the practice or the specialty, I know there are some part-time position on infectious disease and rheumatology offices.
Okay.
And also they do part-time on primary care offices.
Excellent. Lori, how about, I'm guessing from all of the shifts that you described?
We have everything. We
Yeah.
have 16-hour shifts. We have per diem shifts. There's a couple shifts that are, instead of people couldn't work the 40, there's 32-hour shifts.
So when you say like 16-hour shifts, it would be 16 hours in a week.
Yeah.
So it would be like 2 8-hour days.
Yep. Or one of it was 3 to 7. They were working 3 to 7.
So that's 4-hour shift at a time, and you could do multiple days in a week.
Yeah, or 5 to 9, 5 a.m. to 9 a.m. A couple 16-hour shifts, because that works great for us, if we don't need someone for the whole 8 hours. And then the per diem's great. We can kind of make that to what we need. If someone's going to be out, someone has to leave for an appointment early, we might have a per diem come in for 3 or 4 hours just to cover that.
Great. And remind me again, how long is the training for a phlebotomist?
It can be anywhere from, you can take an accelerated course for 8 weeks up to a 6-month course.
Okay. But that's somebody potentially who later in their career, maybe looking for a little change, could do that in fairly short order and get themselves a part-time job.
Absolutely. That's exactly what I did. Yep.
Great. Excellent. Angela, are there part-time PCAs?
Yep, we have per diem, part-time, full-time. The per diem requirement's just 2 8-hour shifts a month. The part-time is 24 hours a week, and the full-time is 32 hours a week.
Okay, great. And then Paul, I don't know if you want to cover
we have
your areas.
A lot of part-time available in food service. We have actually an open position in transport for a part-timer right now, and materials management for a part-time position.
Oh, so we have open positions right now that people could apply for.
We don't have any environmental services.
Lori does too.
We do too.
Actually, I'm wrong.
So we should say, where are these positions posted? nwh.org, is that where they go?
Yes.
Okay, and you can look for all these positions. So sorry, Paul, I cut you off. Keep going.
Yeah, that's okay. Actually, we do have some in environmental services as well, but that's per diem and not part-time.
Okay. And so per diem, can you just explain per diem for anybody who might not understand what that means? Because I think that might be a healthcare term that maybe not everybody knows.
Yeah, so you're not guaranteed any hours. However, we look for flexibility to fill open positions. I mean, you could be working 40 hours a week to cover vacation if you're available, obviously, or just weekends or whatever. So we kind of negotiate. There is a minimum, I think it's 2 shifts a week. I'm sorry, a month for per diem. But that's.
So do you call the per diem folks and say, hey, I got a shift next week. Can you fill it?
We do.
Is that how it works?
Yep. Or we'll schedule them. It's like to cover a vacation or.
Okay, because you know somebody's going to be out. Okay,
right.
Great. All right, so I think we covered that question. That's good to know. Let's see. So this question, Angela, is PCA specific. So this person said, I'm a senior in high school and will be attending college next fall. I'm interested in working in healthcare in the future and would like to gain some exposure by being a patient care assistant. Can I take a PCA course? And you may not know this, so feel free to tell me, Angela, if you don't feel comfortable answering. Can I take a PCA course before graduating from high school? Do you know that?
Yep, you can. I took one my junior year of high school.
Excellent. And then would you recommend a PCA position for somebody who's interested in becoming a physician assistant later in the future?
Yeah, absolutely. I worked with a bunch of PA students who were applying in their gap year, and they got a ton of patient care hours. I know some of them, I think it depends on the school, but you need around like 1,000 patient care hours before you can apply to PA school, and they could just pick up shifts per diem or part-time or full-time even during their gap year and pick up a ton of patient care hours. And they said it was really helpful with learning how the whole hospital system works.
Yeah, that's what we've heard a lot of is getting into those roles. If you're thinking about going on to further your education into another clinical type role, it's great to start with that. Excellent. And then let me see. So I think I answered that one. Angela, here's another one for you. Can you review the range of shift hours for the PCA again? Can you go over just what the various shifts were?
Yep, they have 7 a.m. to 7 p.m. So that's a 12-hour, and then 7 p.m. to 7 a.m. to 7 a.m., which is another 12 hours. That's overnights. And then they have 7A to 3P, which is the day shift, 3P to 11:30 P, which is the evening shift, and 11 to 7:30, which is the overnights.
Okay, great. Thank you. Let me see. There's a question that maybe I'll throw this out to Paul since you're in your leadership role. So are there standard timeframes or skill assessments during performance reviews so people can gauge how long it takes from an entry stage 1 to a supervisor role? So how do you sort of have that conversation with an employee?
Yeah, so we look for, so first I get a yearly evaluation, a yearly appraisal. And then that gets into details how you've done for the year. So we have, so you do that. If you're looking for leadership roles, we'll definitely train you. We'll look for how you interact with your peers, start you off as a lead. So a lead would be running a shift. And so we'll kind of test you out on how you actually run a shift, managing other people. You wouldn't give them an appraisal or anything, but you're just managing the shift that you're running. And then that'll give us an opportunity to just kind of see how, what the future would bring, how you would be as a supervisor. And if you'd like to try the supervisor role, we have a lot of training. Mass General Brigham also has a lot of training available for you as well.
Okay, excellent. So the next question, I think, Paul, could be a good one for you, but I will open it up to anybody who might want to answer this. It says, is training provided in-house for advanced positions, or is it external? So if there are any, like, I don't know in respiratory therapy, Samantha, if folks can sort of move up to more senior roles within respiratory therapy, is there training provided internally, or would that be externally? So I throw it out to anybody. Lori, I don't know if there are levels in phlebotomy where people can move up, and what kind of training is needed, if anybody wants to answer that.
In phlebotomy, I started as an outreach person. I worked in an office for 3 years, and just like anything, job gets posted, people move on. And I was able to become one of the coordinators, just the next tier up. So now you're still doing the job, but you're also coordinating people to do the job. Kind of where I'm more of a support staff for our outreach locations. So yeah, there is in training, definitely training. Again, we do competencies. We have 6-month competencies, year competencies, just to see where people at and how much they learn. We have in phlebotomy, there is a huge amount of things to learn. So everybody learns at a different rate, and everybody's presented to learn at a different rate, so we can keep the department running as we need to. So yeah, there's definitely areas that you can move up in phlebotomy.
And a lot of internal training that's provided in order to follow those career paths, it sounds like.
Absolutely, yeah.
So anybody have anything different that they want to add from that?
Yeah, so like I said earlier, it's for the up to the supervisor position, that would be, we could do internal training and also years of experience. For management, we're really looking for some kind of college level.
Yep. Okay, great. This next question, Paul, I think I'm going to turn to you again, but I don't know if Amy Ryles, our welcome speaker, is still listening in. If she wants to join in on this question, there she is.
Hi, I'm still here.
So this question says, the high school diploma GED is a barrier for immigrants and minorities with disproportionate graduation rates. How is the hospital addressing that systematic issue for these entry-level roles? So I don't know if you have an answer for that.
Yeah, I really appreciate that question. I think that's very insightful. So, we do work to look at all of our roles and ensure that the qualifications that we identify for each person, the minimum qualifications or each position, are appropriate based on those responsibilities. So I think we have to have our eyes wide open and be mindful that sometimes those qualifications could prevent opportunities for individuals with varying backgrounds. So it's something that we have to continuously keep an eye on. And certainly, work with our leadership and colleagues across the system to ensure that we're providing opportunities to recruit diverse individuals. So I greatly appreciate the question and understand the challenge.
Excellent. And Paul, I don't know if you have anything you want to add. I know you do have a number of folks in your areas that are immigrants. So I don't know if you have any thought that you want to add to that.
So we do have an agreement with the organization that teaches English as a second language, or English for speakers of other languages. That opportunity is open to anybody in support services. So we have ongoing classes. We have a lot of people who have language barriers as well. And, Emmy's got somebody who started off who couldn't even speak English, and now she's doing a great job down at Charlie's. So we definitely would consider anybody who's, a hard worker and who's gonna kind of be there for us. They have a lot of opportunities at Newton-Wellesley.
Excellent, thank you. All right. So I guess we're going to get wrapping things up here. So I think what I will do is just sort of go around again. Thank you, Amy, for jumping in. Go around again and just sort of ask everyone, what do you like best about your job? And maybe what do you like the least? Maybe start with the least and we'll end with the best. Because I feel like there's always something in your job every day that you don't like. So Samantha, why don't we start with you?
The least favorite part sometimes can just be, you have so much going on all at once and you want to give the best amount of care to each patient. So sometimes, you get frustrated because you only have a certain amount of minutes that you can spare, or that part of it. Sometimes I like to be there as long as I can to provide the best care. And the best part of my job is probably going to deliveries and seeing a baby take their first breath.
I know when you said that earlier, I was like, oh, that's awesome.
I love that part of my job.
Oh, that's great. Thank you. Saray.
So for me, the least favorite thing of my job is the phlebotomy part. That's why I choose cardiology, because I know there's not going to be any
so Lori,
needles
Saray's
there.
not going to be joining your team anytime soon.
Right. And my favorite part of the work is just to engage with patients. I mean, I've been so long in the practice that I already developed a friendship with some patients, and they're really, the patient and I were really happy to say, hey, how you doing, my friend? So those things. And definitely working at Newton-Wellesley, you get the feeling that you're working with family. All the providers are really welcoming to new staff, and since it's a teaching hospital, they teach the students and they also teach the staff when they have any questions. So it's really that's my best. The best thing I can get from Newton-Wellesley is the welcoming for everybody and the teaching.
Excellent. Lori.
I enjoyed the teaching too. I love seeing people grow in the job. It's not an easy job. Phlebotomy is a lot about perseverance. I feel like if you have the skills, the dexterity, and the desire to be a hard worker and really try, you can really excel at it. And that's my favorite thing. Just having a challenge, having a hard patient. And our favorite is when people say, oh, I didn't even feel anything. We love that. We want to make the 5-minute experience with us the best experience that we can. So, waking people up, just being happy, trying to spread as much happiness and whatever we can give somebody in 5 minutes or less.
Excellent.
So that's probably our favorite thing.
Great. Angela, how about you? Least favorite and most favorite?
My least favorite is probably the unpredictability, because I'm per diem, so I'm the first to float or the first to sit sometimes, but it's also kind of exciting not knowing, because I never do the same thing 2 days in a row, which I like. And my favorite part is connecting with my patients and knowing that something that I did made them feel better.
Oh, that's great. Because you said you're going to nursing school, right?
Yep, I'll graduate in a couple weeks.
Wow, congratulations.
Thank you.
So then this is has really reinforced for you that nursing is the path that you wanted to go.
Yeah, absolutely. And it makes everything in the classroom make so much more sense too.
Oh, great. And does it also help you get a job as a nurse if you're already sort of in the door at Newton-Wellesley?
Yep, I've had a couple conversations with my nurse manager, and I got my senior preceptorship in the ICU there too.
Great. So that's probably another sort of reason why it's great to be a PCA when you're going to nursing school.
Absolutely. I think it's the best thing I could have done to make everything in nursing school way easier.
Awesome. Excellent. All right, Emmy, I will turn to you. So if we think about maybe not so much your job, but if we think about the food service workers and the cooks and all of that, what do you think they like least and best about their jobs?
I think making patients happy and fitting patients and making sure they get great feedback for the patient when they cook their food. It's very, very rewarding to them. there's patients who don't like the food, and sometimes it's just because of the diet. They're on a low slow diet or something. They get the feedback. We need to learn how to cook better, but
Right.
it's sometimes it's because of the diet. So I could say that the challenges that arise every day, and sometimes folks are always are able to deliver and satisfy our patients or our nursing staff when they need something from us. It's very rewarding to our staff.
Excellent. So yeah, I'm sure for the downside, when I'm on a cardiac diet and I can't have a hot dog, you hear about it, but that's not your
Yes.
fault.
No,
That's just the way it
hard to
goes.
explain.
Right. Yes, excellent. All right, thank you. So then Paul, we'll round it out with you. If you can go through, and again, I think it's just probably feedback that you get from your team of like, what do you think for each of these roles, their least favorite and their best part of their job is?
Yeah, I think least favorite for like certain materials, we've had some supply chain issues, and so we've had a lot of out of stocks. So that's frustrating because you've got, you know, a nursing leader looking for a product that we don't have because we couldn't get it. So I think that's been certainly a
They are the
challenge.
messenger.
Yes, that's been a challenge. And you know, a lot of patients in the hospital really don't choose to go to the hospital. You know, it's not like you're going to Disney World where you're going on vacation. You know, they're in the hospital to fix themselves up a little bit, and so a lot of the patients may not want to be there, and that can cause a little difficulty. And so I've actually had some housekeepers that turn a patient's attitude around just by talking to them, which is good. So you can turn a negative into a positive. And then conversely, the positive side is the patient interaction, I think, is really, really great. A lot of people really get to know their patients and get very friendly with them. And it's really nice to see that.
Excellent. All right, great. So I think it was 8:29. We are right on time. Look at that. So a huge thank you to all of our panelists. You guys were amazing in the session tonight. I really appreciate you spending all of this time and sharing all of your information about these various roles. And thank you to all of our attendees. I think we had great questions and we were able to really dig in to explain what all of these roles are about. So on behalf of the Workforce Development Council and Newton-Wellesley Hospital, I want to thank everyone who participated in this session tonight. We hope everyone found it informative as you think about a future career journey in healthcare. We invite you all to join us for our fourth and final session that will be in January on Wednesday, January 19th, same time, 7 p.m. to 8:30. And in that, we will feature tech roles. So there'll be a radiology tech, sterile processing tech, medical tech in the lab, pharmacy tech, a surgical tech, a physical therapy assistant, and a rehab tech. And we'll go through the same thing, explaining what the roles are, what the educational requirements are, and what it's like to do those jobs. So thank you so much to everyone. We really appreciate it. And I hope everyone has a great night and a really great holiday season. So thanks so much.
Thank you.